Under the leadership of Gail Boudreau, Anthem has been investing in communities and working to support at-risk populations that have been most impacted by COVID-19. To share more about their efforts, we'll hear from Merrill Friedman, Anthem's Senior Director of Disability Policy Engagement. Merrill will outline some of the challenges that they have seen, including the digital divide and access to telehealth, and how vaccine information is accessed and vaccines distributed. Merrill brings extensive experience to our panel discussion. She has served on numerous national boards and commissions and was appointed by President Barack Obama to the President's Committee for People with Intellectual Disabilities. We are so fortunate that she can be with us today to share her expertise and Anthem's work on this critical issue. Merrill?
Great, thank you so much. Can you hear me okay?
Yes.
Perfect, thank you. So good afternoon, everybody. Thanks for joining us today. I'm going to jump around a little. I'm terrible at slides anyway, but I am going to jump around a little bit because so much of this really was teed up earlier. So if I'm not completely aligned with my slides, please forgive me. But hopefully we'll have a fabulous discussion anyway. I think when we look, generally speaking, right across the board and talk about health equity for people with disabilities during the pandemic and beyond, we're all looking to the future, right? We want to know what the future is going to look like as we're in this. Some people feel we're in a transition phase of re-engaging, but I don't think we can lose sight of all of the things that have occurred throughout the pandemic, because really these disparities existed before. The pandemic really shone a light on them that was, quite astonishing. And so I think we have to take all that into consideration as we look at re-engaging, but also realize as many people are out and about and seemingly going back to activities like where they were prior to the pandemic, that many people with disabilities, many older adults, and many new people who have joined the disability community as a result of COVID do not feel like we are coming out of the pandemic at all. And so it is very much something that we need to address collectively and not lose sight of what's happened. I'll also talk a little bit about vaccine hesitancy, vaccine advocacy, supporting people in this new era, and how the disability community, and this is already teed up, right? You can join the disability community at any time. And throughout COVID, we had many people join the disability community. So it is a great time to be really talking about disability advocacy and all of the resources that exist for people with disabilities. There are long-lasting effects for people with chronic conditions as well, and just a swell of people experiencing mental health conditions. And then if we start to really talk about intersectionality and the impact on people of color, people who identify as LGBTQ, we need to be very collective and very inclusive at who's joining us within the conversations. And I'm going to see if I can figure out this. Okay, there's a little bit of delay on the slide movement, so please forgive any clunkiness there. So why the disproportionate impact? People with disabilities and chronic health conditions really do rely on a lot of people for support and care and services across the board. So not every single person relies on a lot of people, but we do have a lot of folks coming in and out of people's homes, right? Which during the pandemic was very frightening for people. So when we talk about delayed healthcare as a country right now, really looking at some of the people with disabilities and chronic health conditions that were not able to delay healthcare. And so we really had to focus our work on ensuring that people who were going into people's homes were supported and that people were, able to feel comfortable throughout that. When we get to some of the telehealth stuff, I always talk, we, worked through the very early on in the pandemic. By about March, April, we did about 3 years or 5 years worth of changes and advancements in telehealth in about 3 weeks. And it was, it was tough. There were some bumps and hurdles, but it really did for those people who were able to access technology and were able to utilize the services of telehealth. It really did help a lot of people in that process. Part of the disproportionate impact relies on accessible communications and information. And I probably should say lack of accessible communications and information. There are a lot of people that did not, or a lot of reporters, a lot of state government officials that didn't have ASL interpreting in announcements early on. We did not have information in plain language. Information was changing rapidly in accessible formats. We're not keeping up. So I think this, movement of saying we're going to be thoughtful, intentional, agile, responsive really has to include people with disabilities in this discussion and how we do that. We are disproportionately impacted, and therefore we need to be, if you want things to go right, or at least as right as they can for people with disabilities, it really helps to have us involved at the very beginning. I thought when we started to, within Anthem, look at, okay, what are we going to do? We have to change our service coordination model. We can't go into people's homes. We have to use, different platforms like Zoom, and, create ways for people to sign in DocuSign, and we need to engage people more frequently. We reached out to community leaders within the disability community, as well as Anthem's National Advisory Board improving healthcare services for older adults and people with disabilities. We said, here are some ideas that we have, but my gosh, give us your ideas, right? Talk to us. What works, what doesn't? I got very involved. We all did, talking to our members, getting ideas from our members, because we didn't want to just find ways, to try to engage with people with disabilities throughout this pandemic without asking what would even work. So I think it just seems so fundamental, but for some reason, collectively, we have a very hard time doing that. We don't do it enough. So I'll say, like, on every single slide and every single bullet, please engage people with disabilities in the conversations as we prepare, and work on emergency preparedness, or as we, talk about how to access services, or if we're talking about what accessible communication should look like. Are they in plain language, easy to read, large print, braille? Constantly be talking to people with disabilities to make sure that you're making things accessible and practical. Okay, I'll get off my soapbox. There are also a lot of people with disabilities, lower wage earners, may not be able to afford some of the conveniences that other people started to afford, like Instacart. I mean, if you've looked at Instacart and some of these other delivery services, the prices were going up due to worker shortages, due to supply and demand. We all, recalled very early on, you couldn't get toilet paper, right? You couldn't get sanitizer. So as all those prices went up, plus you had service charges, that made that very inaccessible to people. It was unaffordable. We talked about, technology and setting up for people who were working from home and people whose jobs didn't allow for them to work from home. People, were also at greater risk of contracting the virus because they may have been using public transportation. So it's not just people coming in and out of your home. It's, are you, using public transportation? Are you out and about? Do you need dialysis, right? Do you need to get to work? So I think we have to really consider going forward, and preparing, and I hope not in the near future, for any other crisis like this, that we're starting to take those things into consideration and making sure that there are accommodations that exist. I think when we talk about not even specific to COVID, there will be other opportunities for us to do better and to take the lessons learned that we have gathered throughout this, last 18 months, because our system needed help before. So we need to ensure that, personal care attendants and direct support professionals are considered essential health workers. They are the ones who are saving lives on a daily basis. They're helping support people from home. We want more people to be living at home and living independently and living in their communities and engaging. So we need to develop that, in-home health worker and, attendant care, personal assistant services, direct service professionals. That workforce needs to grow, gain, have a trajectory of professionalism and support. Should have had ready access immediately to PPE. We moved PPE to attendants and direct support professionals very quickly, and in-home health workers, because we knew the risks both for the workers and for the individuals who were receiving care. And so I think, next time we go about this, that shouldn't even be on the table for discussion. It should be an automatic. That's my opinion. But I do think, our direct care workers are saving lives and should be supported as such. Incentive payments should be included, right? We talked about all of these things. We moved quickly to try to get them included, but they should be part of an infrastructure. People with mental health disabilities that were experiencing exacerbations throughout the pandemic. Some people were experiencing mental health condition for the first time, or mental health concern, and starting to navigate not just the mental health experience, but mental health services. So we've been, we work very closely, of course, with NAMI and Mental Health America to look at screenings and outreach and resources and peer platforms to help people through this, time. We even had a few opportunities to test out virtual peer support programs so people could stay connected. Let's see if I can get us to the next slide, my multitasking today. Here we go. So we cover a lot of this, right? But things need to be accessible for people. We need to get access to technology and internet. We sent lots of laptops and iPads and iPhones and different technology out to people. Chromebooks to get, for young people who were trying to learn in school, or other people who were given an opportunity to potentially work from home but didn't have the access to it. And then the access to the technology for any healthcare access services. Social and community resources and supports. My gosh, we talk about social isolation so much. And at a time when people were encouraged to physically distance, social isolation became more and more prevalent. And I remember doing a consumer is what they called it. It was a consumer webinar early on. It was April, May, and people were saying, even just, pull up in my driveway and talk to me. Just drive by and talk to me. People were so incredibly lonely. Older adults, people with intellectual developmental disabilities, others who were not comfortable with the technology and didn't feel like that was a connecting. We know that loneliness kills more people than smoking cigarettes. We have to find ways to help people stay connected in a virtual world, but help people feel comfortable and use the know-how, right? The information to be connected. And then, of course, broadband is going to be one of those things we are going to be talking about for a long time. We have to extend broadband so people have, the opportunity to dial in, if you will, to do that. Physical access barriers have existed forever. Clearly, people weren't seeing their, physicians and their service providers as much, during that time. But I still think, as we prepare more for other disasters, physical access barriers need to be addressed. And then attitudinal barriers for providers and others, implicit and explicit bias and misconceptions about people with disabilities, and, not acknowledging, people's ability to self-direct their, care and services and live independently with the supports required to do so, and really changing the attitudes and the resources that we inform providers with. The more that we inform providers of the independent resources or the resources that help support independence out there, the easier it will be for providers to more naturally, talk about those versus other segregating care and resource opportunities. So I think we have to take all of these into consideration moving forward. Let's see. Here we come. The digital divide. I know we've talked about it, so I'm not going to spend a lot of time on it to kind of speed up this piece here, but just remembering that it's not a one size fits all. And we need to be able to accommodate people throughout the technology wave that we all live in. My computer crashed 4 times already this morning. I was like praying it wasn't going to crash during this. It is just not, it's not the be all and end all, but it certainly is a game changer that we want to rely on and that people are asking for us. So, I'll kind of begin to close out here and say, as we look at addressing disparities for people with disabilities, we can do and provide resources all day long, but we have to be intentional. We have to talk to people with disabilities. We have to have them in the conversation. I'm saying them, I'm a person who self-identifies with a disability, ADHD, but having people engaged at the table when we're talking about public health planning. This is emergencies and disasters, whether they be, tornadoes or, power grid outages or another pandemic, or even working through the pandemic that we continue to exist with today with COVID-19. So I think everything starts there for me. And then finally, talk a little bit about, we did form at the beginning of 2020, I think 2021, the Vaccine Information Collaborative for people with disabilities and older adults. And we, just kind of gathered lots of disability and aging leaders and said, what can we do? We don't want to reinvent the wheel. We don't want to duplicate other people's work, but we want to get accessible information, out to people in the easiest way. So we pulled a resource together. It is on the console, really talking about vaccine advocacy, and it covered a lot of things that was talked about before. So I'm not going to go through it here, but our resource is up, and we are always happy to engage, and I'm happy to take questions when we get to them. But I'll turn it back to Emily.
Thank you so much, Merrill, for breaking down how COVID-19 exposed existing disparities for people with disabilities and outlining some clear and intentional steps that can be taken to advance health and equity for this community.